Hi, this is Shayna and Tanya, and we're doing the PowerPoint on racial disparities in maternal health. What is maternal death? Defined as death of a woman while pregnant or within 42 days of being pregnant from any cause related to or aggravated by the pregnancy or the management of the pregnancy. This does not include women who died by suicide or homicide. What is racial disparities? The term health disparities is often defined as a difference in which disadvantaged social groups such as the poor, racial ethnic minorities, women, and other groups who have persistently experienced social disadvantage or discrimination systemically experience worse health or greater health risks than more advantaged social groups. So the reason why we chose the racial disparities in maternal health, because it's been something that's been going on for the longest. African American women have been dying through childbirth. What is racial health continue? Racial disparity health continue. When the term is applied to certain ethnic and racial social groups, it describes the increased presence and severity of certain diseases, poorer health outcomes, and greater difficulty in obtaining healthcare services for these races and ethnicities. When systemic barriers to good health are avoidable, yet remain, they are offered to as health inequities. Some statistics are, in the US, Black women are 2 times more likely to die from complications of pregnancy than white women, depending on where they live. In 2018, the year with the most recent national data, a total of 658 women in the US died while pregnant or within 42 days of the end of pregnancy. In 2018, there were 17.4 maternal deaths per 100,000 live births in the United States. The maternal death rate among Black women was 37.1 deaths per 100,000 live births, a rate up to 3 times the rates for non-Hispanic, white, and Hispanic women. The maternal death rate among women 40 and older was 81.9 deaths per 100,000 live births, almost 8 times the number for women under the age of 25.
Some of the reasons are heart disease and stroke are the leading causes of all maternal death. Public health and human rights emergency, lack of access, poor quality of care. Black women are undervalued. They are not monitored as carefully as white women are. When they do present with symptoms, they are often dismissed. Racism and structural racism, implicit bias, sexism, other systematic barriers that have contributed to income inequality. Implicit or unconscious bias is another reason. Implicit or unconscious bias operates outside the person's awareness and can be indirect contradiction to a person's exposed beliefs and values. What is so dangerous about implicit bias is that it automatically seeps into a person's affect or behavior and is outside the full awareness of that person. Implicit bias can interfere with clinical assessment, decision-making, and provider-patient relationships, such that the health goals that the provider and patient are seeking are compromised. And you can also see that there's a video that is linked to this PowerPoint that you're welcome to see. Some factors are Black women are typically paid just 63 cents for every dollar paid to white non-Hispanic men. Median wages for Black women in the United States are $36,227 per year, which is $21,698 less than the median wages for white non-Hispanic men. These lost wages mean and their families have less money to support themselves and their families, and may have to choose between essential resources like housing, childcare, food, and healthcare. Compared to white women, Black women are likely to be uninsured, face greater financial barriers to care when they need it, less likely to access prenatal care, Continuing on, Black women experience more maternal health complications than white women. Black women are more likely to experience complications throughout the course of their pregnancies than white women. Black women are 3 times likely to have fibroids, which are benign tumors that grow in the uterus and can cause postpartum hemorrhaging, than white women. And the fibroids occur at younger ages and grow more quickly in white women than in Black women than in white women. Another thing is Black women display signs of preeclampsia earlier in their pregnancy than white women. This condition, which involves high blood pressure during pregnancy, can lead to severe complications, including death, if improperly treated. Black women experience physical weathering, meaning their bodies age faster than white women due to exposure to chronic stress like socioeconomic disadvantages and discrimination over the life course, thus making pregnancy riskier at an earlier age. Black serving hospitals provide lower quality maternity care. 75% of Black women give birth at hospitals that serve predominantly Black populations. Black serving hospitals also have a higher rate of maternal complications than other hospitals. They also perform worse on 12 to 14 birth outcomes, including elective deliveries, non-elective cesarean births, and maternal mortality. Some of the key points that we've learned are many women have a difficult time accessing the reproductive health care that meets their needs. Access to reproductive health care, which helps women plan their families, improve health outcomes for women and children. Black women express higher rates of unintended pregnancies than all other racial groups, in part because of disparities in access to a quality contraceptive care and counseling. Many Black women also lack access to quality contraceptive care and counseling. For example, in a recent analysis of California women enrolled in Medicaid, Black women were less likely than white or Latina women to receive postpartum contraceptives, and when they did receive it, they were less likely to receive a highly effective method. Black women access to abortion is limited, and they may be more likely to experience the ill effects of abortion restrictions, such as delayed care, increased costs, or lack of access to care.
America was already failing Black mothers. COVID-19 is making it more dangerous than ever. As discussed on the previous slides, Black women do not get the care that they need while in the hospital. More than likely, when there's something wrong, they're ignored. When they're in the emergency room, they're called on last. And the statistics show that. The coronavirus has exposed how our country failed its most vulnerable. Look at the tragic case of Amber Isaac, a 26-year-old Black woman from the Bronx who died shortly after giving birth via emergency C-section. She suffered from an abnormally low blood platelet levels, which inhibited her blood from clotting. Because of the pandemic, she was receiving remote care via video meetings instead of in-person appointments. Had she been in for blood tests, her providers would have noted that her platelet levels had been falling since February. Amber tweeted on April 17th, I can't wait to write a tell-all about my experience during my last 2 trimesters dealing with incompetent doctors at Montefiore, referencing the hospital she died at 3 days later. And here is the link where you can see her Twitter post. And it's just like that. During the pandemic, yes, we can't be seen, but pregnant women should be the exception to the rule. You cannot provide health care for pregnant women over the phone. You can't see the baby. You can't check the heart rate. You don't know the vitals. And things like this is very important to any woman. But Black women, of course, get the back end of it. Upon our research, we came across Black Mamas Matter. We thought it was very important to bring awareness to this organization. Black Mamas Matter, they envision a world where Black mamas have the right, respect, and resources to thrive before, during, and after pregnancy. Here's a picture of the women who started it. It's a Black woman-led sectoral alliance. They advocate and drive research, build power, and shift culture for Black maternal health, rights, and justice, which is very much needed and has been for many years. The goals of Black Mamas, which we believe ties into the whole racial disparities in maternal health. Changing policy, which introduced an advanced policy grounded in the human rights framework that addresses Black maternal health. Inequity improves Black maternal health outcomes. They cultivate research, leverage the talent and knowledge that exists in Black communities, and cultivate innovative research methods to inform the policy agenda to improve Black maternal health. Advanced care for Black mamas. Explore, introduce, and enhance holistic and comprehensive approaches to Black mamas care. During the COVID movement, I've seen a lot of women, African American women, who have decided to take on doulas and do home births because of lack of medical care due to only telehealth, which is pretty impractical when you're giving a birth. When you're giving birth, you have women have a whole child inside of them with, their own heartbeat and things like that. And sometimes taking a holistic approach is better. So it's good that Black Mamas, has this organization available to those women. But I've also seen an uptick here in the mass area of doulas. They also shift culture, redirect and reframe the conversation on Black maternal health, and amplify the voices of Black mamas, which is also needed. Black mothers need to tell their story and how they go through what they go through when it's time to give birth. Often it's supposed to be an experience where, it's a happy moment, but sometimes it's not that for the mothers because of the care that they're giving, or the care that they're getting rather. This is some of the work that Black mamas do. They increase the visibility of Black women leaders, which is needed. They cultivate the deep bench of Black women leaders, recognized for the expertise, contribution, and work. They support collaborations of stakeholders working to advance Black maternal health. Creation of Black Mamas was created out of a need to form an entity that can hold space and serve as a platform for Black women, led initiatives that are working to address the issues that impact maternal health disparities and inequities, using the human rights, reproductive justice, and birth justice frameworks across all sectors. And here is a little video about that, and the link is attached if you would like more information.
Reproductive injustice. For the last 4 decades, Black women have been dying in childbirth at a rate 3 to 4 times more than their white counterparts. And if you do your research as we did, you will see that this has been an ongoing problem for years. Cities and states with a high African American population also have the highest rate of maternal mortality in the country. Again, within the research, we found that this is happening all over. It's not just one state, it's not just 2 states. But within the 50 states where there's a large African American population, this is what is happening. In addition to race, diverse of maternal mortality in the U.S. include social determinants of health, such as poverty and lack of health insurance. Women of color are much more likely than white women to live in poverty and to lack health care insurance. Because of these barriers to health care access, women of color are more likely to exhibit risk factors for maternal death, such as diabetes and heart disease. And it's not just that they have these issues, but as well as the doctors are not following up, especially where they're getting their care in the Black area, a Black neighborhood. They're not being cared for in the way that they should, versus if they went out into a suburban area, their care would be completely different. Disparities in quality care also persist for women of color and poor women, and in some cases are growing worse in the U.S. The U.S. Department of Public Health and Human Services identified maternal mortality as one of the most rapidly deteriorating areas of health quality over the past 3 years. Black Mamas and COVID-19. Attached, we have a link where Black Mamas has an interview and they're giving more information on, COVID-19 and what they stand for. How can we improve Black Mamas' maternal health? Expand and maintain access to health coverage. 87% of Black women of reproductive age have health insurance. We can provide patient-centered care that is responsive to the needs of our Black women. Address the social determinations of health. Expand paid family leave, because we know that's one big issue as well. Expand access to quality, patient-centered, and comprehensive reproductive health care. Expand and protect access to trusted community providers. Expand protections for pregnant workers, and invest in healthcare safety and quality improvement. Initiative.
So again, coming through our research, these are a bunch of links or a few links on Black women who have experienced racial disparities during childbirth. Serena Williams and Beyonce both had stories on how their childbirth went, and it wasn't so great. Kiara Johnson is another one, Dr. Bayette or Betty Ford, and then there's another one on Betty Ford as well. There's two of them. The conclusion is, at the end of the day, Black women deserve to have a safe and healthy pregnancy just as any other woman deserves to have a good childbirth. To meaningfully improve Black maternal health outcomes, we need to change. We need systemic change that starts with the healthcare system, improves access to care and makes the place Black women live and work healthier. They are more responsive to their needs. Only when we do that will Black women be able to achieve their optimal health and well-being throughout their lifespan, including if they choose to become parents. And just on a personal perspective, I remember when I gave birth to my 5-year-old, I had a horrible experience. I was rushed from one hospital to the next and discharged as well. Was told that I had a blood clot in my uterus and that my baby wasn't going to make it. By the time I reached the other hospital at 25 weeks, I went into full labor, had an allergic reaction to the medication they gave me to stop the labor, and there was no good bedside manners. I was treated poorly, and I didn't get the service that I needed, and as a result, I almost lost my child, and then was stressed by me being told that my child wasn't going to survive. So that wasn't fair to me, and I can only imagine some of the other things that other women go through, like preeclampsia, and other things that can happen during pregnancy. And only when we make the communities better, that will help and cater to Black women during their pregnancy, is able to help achieve their optimal health and well-being throughout their lifespan, including if they choose to become parents. So ultimately, we just need to have the same treatment as any other women during childbirth. And then this is the list of our references.